I'd like to bring Fran in at this point because her team receive these referrals in from the LSAMOs. Fran, what do you get from an LSAMO?
We have introduced a specially designed referral form for LSAMOs to use, and this asks them to give the details of the background to the referral. This will include whether a midwife has undergone any local action or a practice programme, and if so, what the outcome was. The form will ask the LSAMO to explain whether any further local action might also still be available. For instance, if the midwife was suspended but the LSAMO had been able to arrange a practice programme that could be put in place. This will also be detailed on the form. We will include these referral forms in the interim order hearing papers so that the panel may be able to see whether there is a reasonable prospect of a practice programme being arranged and undertaken.
Do you have any other contact with the LSAMO before an IO hearing?
Yes, we notify them of the hearing and ask them to make themselves available, either in person or by telephone. And this is in order that they can be asked about the workability of any conditions that the panel might be considering.
What about in cases where the referral doesn't come from the LSAMO, for instance if it comes from the police or a member of the public?
It depends on the nature of the allegation. We will always let the LSAMO know about referrals in relation to midwives, but if the allegation is unrelated to their midwifery practice, we will not ask them to be available to attend any IO hearings.
The NMC has issued guidance for panel members on conditions of practice. What does it say about the general requirements for conditions?
They have to be relevant, proportionate, workable and measurable.
And what does it say about the involvement of third parties, like LSAMOs in conditions of practice orders? We've heard from Han how much input is required.
Firstly, the guidance makes it clear that the panel cannot require a third party to do anything. It can only require that the midwife do certain things. The guidance says that when a panel is considering imposing conditions that do require input from a third party, that they should obtain comments about this from the parties involved and the third party where possible.
And how do they do that?
In cases using the new referral form, the LSAMO will already have indicated whether there's a prospect of them being available to arrange any kind of practice programme or other local measures. In cases where that has not been completed, the panel may hear from the LSAMO in person if she is in attendance or on the telephone if she is not present.
What if the LSAMO says that they won't be able to facilitate the conditions that the panel is imposing?
The panel should take into account when considering how workable the conditions are. If there is no prospect of them being met, the panel may conclude that they are not workable and move on to the next step. However, it is always a matter for the panel.
And what about alternative conditions when the LSAMO is unable to support an LSA practice programme, perhaps because the midwife has already failed to successfully complete a practice programme?
In these circumstances, the panel should consider very carefully the outcome of any previous LSA practice programme. If one has been started but not successfully completed, the panel will need to consider the reasons why. If a midwife failed to achieve the objectives or was stopped because a further issue arose, that may demonstrate that alternative conditions would not be enough to protect the public. Remember that an LSA practice programme is a highly structured process with lots of built-in support. If an LSA practice programme has not managed to get the midwife to the required standard or to prevent further issues arising, there may be real grounds for concern for public protection. If the reason for referral was failure of a practice programme, there would have been highly extenuating circumstances before the LSAMO could support a further practice programme. It would certainly not be advisable to require a further LSA practice programme without exploring the workability of this with the LSAMO.
What about return to practice courses and supervised practice for midwives?
There are two other areas that often are used. Return to practice, but return to practice is specifically for midwives who have been out of practice for 3 years and is not normally a process that would be used when under investigation. Equally, you may have been aware of the term supervised programme. This is no longer a term that is used and was replaced in the Midwives' Rules and Standards which came in 2012.
We've talked about the initial stages of the FTP process. Fran, what happens during the investigation of fitness to practice allegations against midwives?
The investigative steps will always depend on the nature of the allegation, but we always do keep the LSAMO informed of what's happening. She may be asked to give a witness statement in relation to the local level investigation and its outcomes. We would also take a statement from any supervisor of midwife who carried out the investigation into the matters giving rise to the allegation. Also, we would ask the LSA for details of the midwife's supervisory history.
And what if the allegation goes to a final hearing?
The investigative steps depend on the nature of the allegation, but we always do try and keep the LSAMO informed of what's happening. She may be asked to give a witness statement in relation to the local level investigation and its outcomes. We would also take a statement from the supervisor of midwife who carried out the investigation into the matters giving rise to the allegation. We would ask the LSA also for any details of the midwife's supervisory history.
And where a panel has found that the midwife's fitness practice is impaired and has heard evidence that a midwife has already failed a practice programme, how should they approach sanction?
They should apply the indicative sanction guidance and guidance on conditions of practice. If the panel is thinking about a conditions of practice order, they would need to be satisfied of a number of things, which includes the midwife's potential and willingness to respond positively to retraining. If a person has already failed an LSA practice programme, that may be a sign that they lack the necessary potential to respond to retraining, even if they're willing to try. Also, the panel would need to be satisfied that women would not be put at risk by conditional registration. If the practice programme was failed because of unsafe practice, that would suggest that conditional registration may not be enough to protect the public.
Before preparing for this film, we asked whether any of the panel members had any questions that they would like to ask around midwifery supervision, and we're going to ask those now. So thank you for those who contributed questions. The first one is for Anne. Anne, what is the LSAMO's role with regards to safeguarding?
LSAMOs play an enormous role in safeguarding women and their babies. They ensure that the supervision of midwives is undertaken in accordance with Midwives' Rules and Standards and other NMC guidelines. Safeguarding is a separate statutory requirement, and as such the LSAMOs are not the individuals responsible for this, other than where a midwife does not follow good practice in relation to safeguarding.
Again for you, Anne, then what level of engagement do they have with the NMC in general, as well as during an FTP investigation?
LSAMOs have various communication commitments to the NMC. They provide quarterly reports and updates on each LSA patch throughout the year that they represent. The NLMC also engages with LSA midwifery officers via strategic reference group. That is in addition to their engagement as a possible source of FTP referrals to the NMC, acting as witnesses in FTP cases and raising concerns about cases or referrals.
Who is responsible for the performance of and the role of an LSAMO?
LSAMOs are appointed by the LSAs, which has the task of managing each LSA midwifery officer. The performance of the LSAMO or any complaints or concerns about the LSAMO should be addressed to the designated officer within the LSAMO's employing authority, who will then decide the most appropriate action and method of investigation.
Fran, this is a question for you. Are LSAMOs involved in every referral of a midwife to the NMC?
The LSAMO will not necessarily be the referrer. We receive referrals about midwives from various people and sources, including employers, members of the public and the police. We always involve the LSAMO if the referral concerns issues relating to midwifery practice. The only circumstances in which we would not involve the LSAMO is if the registrant is a registered nurse and midwife, and the allegations are wholly and exclusively related to their nursing practice.
And the last question is for you, Anne. What is the equivalent of an LSAMO in Northern Ireland, and how does that role work?
Supervision of midwives is a statutory responsibility that provides a mechanism for support and guidance to every midwife practicing everywhere in the UK. The purpose of supervision is to protect women and their babies by promoting a safe standard of midwifery practice. Therefore, each of the 4 countries has local supervising authorities and LSA midwifery officers. In England, the local supervising authority is NHS England. In Wales, it is Healthcare Inspectorate Wales. In Scotland, it lies within the health boards, and in Northern Ireland, the local supervising authority is the Public Health Agency.
That was our final question, but if anybody else does have anything else that they would like to know about midwifery supervision, please do contact the PAL support team and we will respond to you. My thanks to Anne and to Fran for taking part in this training video. We hope that you found it useful. Thank you.